Hello, I'm Dr. Jennifer Negrin and I practice at BodyLogic MD Orlando, where we specialize in anti-aging, functional, and regenerative medicine. I did my medical and residency training at University of Miami in Florida, and I'm initially board certified in family medicine. I practiced family medicine for about 10 years, and I originally went into that field because I really wanted to treat the patient as a whole. I had an interest in wellness and in prevention and in patient education. As I practiced over the years, I began to see that the shift in medicine was more towards disease. We were managing chronic medical conditions, trying to find the right medication to match up with the patient's disease, illness, or symptoms. But there wasn't real curing of disease or prevention of disease. There were also a lot of patients that would come in with all sorts of concerns, fatigue, weight gain, insomnia, mood swings. And we would run the tests that we were taught in our traditional training, and most of the time those tests would end up being normal. And so we were again left with just trying to match which medication we're going to prescribe to improve this patient's symptoms, and oftentimes that was not the best thing for the patient. Luckily, I had some colleagues that were part of the A4M, and so they introduced me to the A4M. And after one conference, that pretty much changed my trajectory in my medical career. I started the fellowship program, and the concept of anti-aging medicine has completely changed the way I approach a patient. Now I look at symptoms more as a clue of something that is underlying, that's deeper, some deeper dysfunction. So you find that some of these symptoms that patients complain of are maybe a food sensitivity or hormonal imbalance or a nutritional depletion or chronic infection. And with the module fellowship training, you're taught how to uncover these root causes. So you find what is the appropriate testing, whether it be in blood, in urine, in saliva. You can find these causes and then create an individualized plan of care for that patient. And that's what was really exciting for me, because in family medicine, so much we were coming up with a diagnosis, and then pretty much everyone would walk out with the same plan. And now you know that there's so many different reasons why patients can present with these symptoms, and when we test appropriately, then we can design a plan that usually will contain lifestyle modifications such as diet, fitness, proper sleep, stress management, the use of nutraceuticals such as supplements and vitamins, minerals, and then when appropriate we can prescribe bioidentical hormones.
About 2 years ago, it just seemed like everything started to just fall apart. I all of a sudden started feeling like I was 90. My body was achy, everything snapped, crackled, and popped when I moved. I was cold all the time. I just was not right. And one of my girlfriends was doing the bioidentical for different reasons and all that, and so that got me curious. I'm the type of person that reads up on everything, wants to know everything about anything I do, and so I'm like, oh, that's interesting, I'll have to start reading. And so I started reading, I got some books on it, I started reading them thinking, geez, this all just kind of fallen right into place, it totally makes sense. And so I had done a search for somebody that did bioidentical. I didn't want to take any of the synthetic crap. So I went and got all my labs done and did everything, and I went in for an appointment, and I was really surprised at how out of whack I was. And one of the things that never crossed my mind was my thyroid. And I had been tested before for the TSH levels. Nobody's ever caught it because it always shows up normal. Well, she was totally on top of the new thinking of it's not just that number, but it also has to do with these other numbers that most other doctors don't even check. And as it turned out, it was the case. I wasn't converting some enzymes, so I was hypothyroid, but didn't even know it, and it wouldn't have been, no other doctor would have known it either. And so sure enough, she put me on the thyroid, and that one was probably the biggest difference. I mean, it was amazing. All of a sudden, I got up out of bed, and the snap, crackle, and pops all stopped. I was just like, wow. Just the deep aching in my body all went away. The weight started coming off. Doing the things that I normally do, I'm almost back down to my normal weight. I feel like I'm 35 now. Instead of feeling like I'm 90, I actually feel younger.
So what I love about working for BodyLogic MD is that I have the opportunity to spend a lot of quality time with my patients, getting to know them. I can take the time to go over patients' test results and provide the proper counseling, and I could truly be their partner on their personal journey to wellness. So if you would like more information, you can head over to our website at bodylogicmd.com, search by state, and we're in Orlando, Florida.